Namaskar, dear students and parents. Welcome back to Trailblazers Consultant, myself, Dr. Poulomi Dutta. And here we are again with our episode 2. In episode 1, we looked at the crisis facing Indian medical aspirants, limited seats, impossible fees, examination scandals, and years lost to NEET preparation. Today, we answered the practical questions: which countries, what fees, and what does the NMC require? And how do you ensure your degree is valid when you return to India? Let's get into the details. Here we'll discuss the NMC guidelines, which are non-negotiables. Before we discuss any country or university, you need to understand the National Medical Commission's requirement. These are not suggestions, they are mandatory. They are mandatory condition. If any single requirement isn't met, your degree won't be recognized in India. The Foreign Medical Graduate Licentiate Regulation 2021 specify 5 conditions. Requirement 1. NEET qualification. You must have qualified NEET UG before taking admission abroad. If you're not applied, you are not qualified. Your NEET scorecard must be submitted during admission. Universities that admit students without verified NEET qualifications are violating NMC norms, and such degrees won't be recognized. NEET score are valid for 3 years for foreign admissions. If you qualified in 2024 or 2025, you can still apply now without appearing for NEET 2026. Number 2, minimum course duration should be 54 months. Your MBBS program must be at least 54 months. That's 4 years of academic instruction. This does not include internship. Be cautious of any university offering fast-track 4-year program. This does not meet NMC requirement. Standard structure at compliant university that has got duration of around 4.5 years, where preclinical will cover 2 years, clinical training will cover 2.5 to 3 years, total academic will be 5 to 5.5 years. Internship should be minimum of 1 year. So to complete the entire program, it will take somewhere close to 6 to 6.5 years. This timeline is similar to Indian medical colleges. No shortcuts, no compromises. Requirement number 3, English medium instruction. The entire course, lecture, practicals, examination must be conducted in English. This eliminates several otherwise affordable options. Many universities in China, for example, taught primarily in China or offered bilingual programs. Post 2021 NMC regulations, such programs are not recognized. When evaluating any university, verify all textbooks and study materials are in English. Examinations are conducted in English. Clinical case discussions happen in English. No mandatory local language requirement for academic completion. Learning the local language for patient interaction during clinical rotation is encouraged and practical, but it cannot be a requirement for passing examination. Requirement number 4, internship at the same university. You must complete a 12-month clinical internship at the same university where you studied, or at teaching hospitals affiliated with that university in the same country. You cannot return to India for internship before clearing FMGE or next exam. Complete internship at a different university is not accepted. Doing partial internship abroad and partial in India is not accepted. This is crucial. Some students try to return early, thinking they will manage internship formality later. They can't. The NMC requires documented proof of 12-month internship completion before you are eligible for the licensing examination. Requirement number 5, university recognition. The university must be listed in World Directory of Medical Schools, that is WDOMS, recognized by Medical Council of its home country, approved by the host country's government health ministry. Before enrolling anywhere, verify the institution on WHO, that is World Health Organization, or WDOMS database. Host country's Ministry of Health website, NMC's official communication. Some agents provide universities that are not properly listed. Students complete 6 years of study, return to India, and discover their degree has no validity. This is devastating and entirely avoidable with proper verification. Now, country by country breakdown of the tuition fee structure. Now let's examine the top destination for Indian medical students with actual fee structure, advantages and consideration. Russia. Tuition fees per year would somewhere close to 3 to 5 lakhs. For 6-year total, it will be somewhere close to 18 to 30 lakhs. Hostel charges would be somewhere close to 40,000 to 80,000 per year. So that is around 2.5 to 5 lakhs in total. Fooding and living cost will be somewhere close to 4 to 6 lakhs for total 6 years. So here you can estimate the entire cost to study in Russia would be around 25 to 40 lakhs. Here are the top universities in Russia: Kazan Federal University, Crimean Federal University, Bashkir State Medical University, Kursk State Medical University, Tver State Medical Universities, and mostly all these universities are government or semi-government universities. They are having established track record with Indian students. They are having strong clinical training in large teaching hospitals, having affordable tuition fees as already discussed. They are having direct flight connectivity from Delhi and Mumbai. So you need to consider few aspects whilst choosing for Russian universities. Harsh winters, temperature drop to minus 20 degrees Celsius. Russian language required for patient interaction. Current geopolitical situation may affect some aspects. Russia is ideal for students who want proven infrastructure, don't mind cold weather, and seek the most established foreign medical education ecosystem. Now, coming to Uzbekistan. Uzbekistan has emerged as the most affordable NMC compliant destination with rapidly modernization infrastructure. Here, fee structure varies from 2.5 to 3.5 lakh per year, which is somewhere close to 15 to 21 lakhs in total. Again, it's 6-year total curriculum time duration. Hostel charges would be somewhere close to 2 to 3 lakh for total 6-year duration. Food and living cost will be around 2.5 to 4 lakhs. And in total, the total cost of study would be around 20 to 28 lakhs. So here are the top universities in Uzbekistan that you can opt for: Samarkand State Medical University, Bukhara State Medical University, Tashkent Medical Academy, Andijan State Medical Institute, and many others. And again, they are government and semi-government institution. So here are a few advantages while studying in Uzbekistan. Lowest overall cost among quality options, just 3-hour flight from major Indian city, safe student friendly environment, growing Indian student community, modern digital infrastructure in newer universities, and most importantly, again, they are following all the NMC norms. They are meeting all the NMC requirement, and they are student friendly and are giving quality education with global exposure. Uzbekistan is ideal for budget conscious family who want maximum affordability without compromising NMC compliance. Now, let's discuss Kazakhstan. Kazakhstan offers a middle ground, more affordable than Georgia, more developed than Uzbekistan. Here, fee structure would cost you around 3 to 4.5 lakh per year, that is around 18 to 27 lakhs in total. Hostel charges would be around 40,000 to 70,000 per year, that is 2.5 to 4 lakh in total. Fooding and living cost will be around 50,000 to 80,000, where it will be total in around 3 to 5 lakhs. And total cost of study for 6 years would be 24 to 36 lakhs. Here are the top universities of Kazakhstan: Kazakh National Medical University Almaty, SKMS Shymkent, Astana Medical University, Samay State Medical University, Al Farabi Kazakh National Universities, and many more. Most of them are again government, semi-government colleges, which are having well-developed healthcare infrastructure, English medium programs. They are having multicultural environment, a little bit of cosmopolitan environment. They are providing better accommodation quality than some other alternatives that we have already discussed. So this is again one of the nicest and the closest option for Indian students, where we have to again consider a little bit of winter like Russia. And yes, visa process required a little bit of attention. Kazakhstan suits Indian students seeking solid infrastructure at moderate cost with more modern amenities than entry-level options. Now let's discuss Georgia. Georgia stands out for one critical metric: the highest FMGE pass rates among popular destinations. Now let's discuss about the fee structure for Georgian universities. Per year cost will be around 5 to 7 lakh tuition fees. That is around 30 to 42 lakhs in total 6 years. Hostel food will cost you around 7 to 11 lakhs in total for 6 years. That is, total package would be somewhere between 37 to 53 lakhs. Here are the top universities of Georgia where we are sending our students. Tbilisi State Medical University, European University Georgia, Caucasus International University, Bao International University. As we have already discussed, FMG pass rate is very high, significantly 60 to 80%, with strong focus on clinical skills, pleasant climate similar to part of India, safe tourist-friendly country, European-style education approach, consideration high fees than Central Asian option. A smaller country with limited hospital variety. Some newer private universities need verification. Georgia is ideal for students prioritizing exam success and clinical competence over minimum cost. The higher fees often translate to better FMG outcomes. Now let's discuss the most closest option for Indian student, Nepal. Nepal offers the advantage of geographical and cultural proximity, almost like studying at home. Here, fee structure for 5.5-year total is around 8 to 12 lakhs per year, so around 44 to 60 lakhs in total. Hostel would be around 50,000 to 80,000 per annum, around 3 to 4.5 lakhs in total. Food will cost you around 3.5 lakh in total. And approximately the total package would be around, will vary from college to college. So it will be somewhere between 49 to 74 lakhs. So here are the top universities of Nepal. Kathmandu Universities of Medical Sciences, BP Koirala Institute of Health Sciences, which is there in Dharan, Manipal College of Medical Sciences, which is there in Pokhara, KIST Medical College in Kathmandu. There are many more colleges under Tribhuvan University and Kathmandu University. For Nepal medical colleges, there are no language or cultural barrier. You will get similar food as you're getting in India. Weather is almost, in most of the region, are similar. Your family can visit you often. Indian faculty often present. There is no visa complication. You can reach there by road, by trains, or by flight. No visa complication. And last but not the least, most important point to be noted, that is highest rate of passing an FMG examination. Why? Because Nepal curriculum is completely a copy-pasted version of Indian curriculum, which has been prescribed by NMC. So their duration is also 4.5 year plus 1 year internship, that is 5.5 year. And if you check with the NMC regulations, you have to clear a FMG, and after completion, you have to pursue 1 year internship here in India. So altogether, you will complete MBBS in almost 6.5 years if you're pursuing in Nepal, which is comparatively a shorter duration as compared to Kazakhstan, Kyrgyzstan, Uzbekistan, or Georgia, Russia that we discussed earlier. Fees is a little bit high, but yes, for the students and the parents who can afford 60 to 70 lakhs, for them, Nepal is one of the best option, where they are getting, of some of the institutions are giving better infrastructure as compared to India. So after completing MBBS abroad, here is your path to practicing medicine in India. Step 1. Complete internship abroad, 12 months. Mandatory at your university or affiliated hospitals. No exceptions. Step 2. Return to India with documents, required documents, primary medical qualification degree certificate, internship completion certificate, university transcript, NEET scorecard, passport with entry and exit stamps, eligibility certificate from university. Step 3. Apply for FMG or next exam. Currently, foreign medical graduates takes the FMG, foreign medical graduate examination. This is transitioning to next national exit test, which all medical graduate, India and foreign, will take. Recent FMG statistics. In December 2025, 43,829 students appeared, where 10,496 students got pass. In June 2025, 45,000 students appeared, and almost 25%, that is 11,250 students passed. The overall pass rate appears low, but university-specific rate vary dramatically. Georgian universities report 60 to 80% pass rate. Quality for undergraduate training directly impact these outcomes. Compulsory rotating medical internship is a step 4. After completion FMG next, you must complete 12-month internship at an NMC approved hospital in India. This is separate from an additional to your internship abroad. Permanent registration, step 5. Upon completing CRMI, you receive permanent registration from your state medical council. You are now a licensed doctor, legally equivalent to any Indian medical graduate. Some students have concern about a recent NMC notice regarding online semesters. Let's clarify. The notice specifically addresses students who completed semesters online during the COVID-19 pandemic. If you took online classes during 2020-2022, have semesters marked as distance or online in transcripts, you may need to compensate with additional physical training at your university. However, if you're enrolling now in 2026 at a university offering 100% on-campus, in-person instruction, this notice does not apply to you. New students following the standard physical attendance model are unaffected. If you have decided MBBS abroad is your path, here is your action sequence. Verify NEET qualification. Confirm your scorecard showing qualifying marks. Valid for 3 years from result date. Shortlist countries and universities. Based on budget, climate preference, and career goals, choose your universities. Verify each on WDOMS and NMC compliance. Contact universities directly. Don't rely solely on agent. Email admission department directly. Ask for NMC compliance documentation, document preparation, NEET scorecard and admit card, class 10 and 12 mark sheet and certificate, passport valid for at least 2 years, medical fitness certificate, passport size photographs, financial planning, first year cost typically 5 to 10 lakh, institution plus travel plus settlement. Explore education loans. Many banks have foreign MBBS scheme. Budget for annual visit home. Timeline for September 2026 intake would be somewhere close to September. You need to shortlist universities and have to submit your application by May or June 2026. Admission confirmation will come and you need to pay fees by June, July 2026. Visa application and processing needs to be done by July to August 2026. Travel orientation class will begin from in between August to September 2026. So applications are open now. If you have a valid NEET score from 2024 or 25, you can begin immediately, or even after June 2026 NEET examination, once their results are out, you can apply then also. Every year, thousands of Indian students complete MBBS abroad and return to practice medicine successful in India. They clear FMGE, they complete internship, they become doctors. The path is not easier than Indian medical college. The study is rigorous, the examinations are challenging, and the journey requires dedication. But it's accessible, it's affordable, it's recognized. If the Indian system has limited seats, impossible fees, and endless uncertainty, you don't have to keep waiting. You have a qualifying NEET score, you have universities accepting applications, you have a September 2026 intake ready for enrollment. The question is not whether you can become a doctor. The question is, are you ready to take the path that's actually available to you? So, your MBBS journey starts now. If you've got any queries related to admission process, if you have any inquiry related to selecting colleges or institution, you may connect us today. We are also assisting students in doing NEET counseling. We can help you with the colleges. We can help you with the choice filling and college selection during the counseling session. And in case if you have already made your mind of going abroad, then do apply today. Log on to our website, www.trailblazersconsultant.com. So your journey starts now. Wishing you all the best. And we will come back with much more information on overseas education for MBBS and other disciplines. Stay tuned. Thank you. Namaskar.